This is a pulse ox. It measures the percent of oxygenated blood circulating around your body. But do you know what the normal range is? Hello everyone, and welcome back to our channel. Today we're diving into an essential topic for every nurse out there, pulse oximetry. Whether you're a nursing student or experienced nurse, understanding how to use a pulse oximeter is crucial for patient care. So let's get started. Pulse oximetry is a non-invasive method that allows us to monitor the oxygen saturation in the patient's blood. It's vital in assessing the efficiency of oxygen delivery to the organs and tissues. This painless procedure can provide valuable insight into the patient's respiratory status. Before we begin, let's take a quick look at the components of a pulse oximeter. You have the actual pulse ox percentage, 97%. You have the heart rate, and down below you have the waveform. The waveform is abundantly important to tell nurses, is this an accurate measure of the patient's values, or is this patient moving or not getting good capillary perfusion? Using a pulse ox is a breeze, but it's important to do it right. Here's a step-by-step guide. Wash your hands and put on gloves. Explain the procedure to the patient and ensure their comfort. Select an appropriate site for the probe, finger, toe, or earlobe. Ensure the pulse oximeter is turned on, usually indicated by a red display light or the display being on. Gently place the pulse ox over the intended site and ensure proper placement. Make sure it's over the nail bed. Wait a few seconds for the reading to stabilize and ensure proper waveform. Note the SpO2 and heart rate displayed on the screen. Intervene as necessary by placing the patient on oxygen, call on respiratory therapy, or telling the physician of a low SpO2 or heart rate. And finally, document the findings in the patient's chart. Now, understanding the results and the values is also crucial in providing proper patient care. Generally, normal findings of a pulse oximeter are gonna be between 93% and 100%. Anything below 93% will be deemed a critical value. However, some patient populations may have different target ranges. For example, COPD or heart failure. If a patient's SpO2 drops below 88%, this requires immediate intervention. It could indicate severe hypoxemia. This requires immediate attention as it could decrease perfusion to the vital organs. Occasionally, you could face some issues when applying pulse ox, so here's a couple troubleshooting tips. Ensure proper placement on the patient's skin and make sure the skin is clean and dry. A patient with a cold extremity may diffuse the value, so make sure you're evaluating a good site to put on the pulse ox. Nail polish could also interfere with pulse ox values. Slight movement could also diffuse the value, so make sure you're telling your patient to stay still and wait for that proper waveform. Remember that accuracy is crucial for effective patient care. And there you have it, a comprehensive guide to master nursing pulse oximetry. By now, you should feel confident using a pulse ox to monitor your patient's oxygen saturation levels and their heart rate. Remember that practice makes perfect, and learning these essential skills will greatly benefit your nursing career and your future patients. If you found this video helpful, don't forget to give it a like, subscribe, and hit that notification bell to receive upcoming updates and nursing tutorials in the future. Thanks for watching, and see you in the next video. Peace.